Welcome to Scrub In, a podcast where purpose meets care. We are more than just a podcast. We are real stories of hope, expert health advice, and inspiring conversations with the people behind the scrubs.
This podcast will leave you informed, inspired, and reminded of the purpose that connects us all. It's the voice of humanity in healthcare, uplifting, honest, and full of heart.
Featuring hosts Dr. Kendall Barton, Keisha Morris, and Alice Rausch. You can listen and subscribe on Apple Podcasts, Spotify, Google Play, and YouTube. Or visit bayhealth.org/scrubin to learn more. Now, let's scrub in. Here's our next episode.
Welcome back to Scrub In.
Today you have Keisha and Alice hosting.
We want to thank our returning listeners, our new listeners who are here today. Our last episode, we talked about women's health with Dr. Melissa Edler. It was a great episode.
Absolutely great. And like with every episode, we like to start with a quote. So today's quote is from Maya Angelou, and it says, "When women take care of their health, they become their own best friend."
That's a good one.
That's a great one.
It's such an important message.
Absolutely.
A great message to share as we're talking today to our guest, Trish Bentley, who's a nurse navigator. Our topic today is Breast Cancer Awareness Month. So much to cover. Thank you so much for joining us today.
Thank you for having me. I like to think that every month is Breast Cancer Awareness Month, but it is a national month to celebrate all of our screening, survivorship, and everything that goes into helping patients have the best possible outcomes.
Agree, and I love that you're wearing pink today to our listeners who are just listening to the podcast and not watching on YouTube. It's a celebratory month. We have our Go Pink campaign. You can buy t-shirts to raise awareness and funds to help with our breast cancer survivorship programs.
Definitely.
Tell us a little bit about yourself and what got you into healthcare.
Well, I actually got into healthcare as a second career. I was a musician, actually, initially. I had a bachelor's degree, and then I just felt called to do something else. I've had privileges of caring for my loved ones at home while they had cancer and other health diseases, that really required a lot of attention. And I just felt that I was drawn to a different career field about age 27.
Wow.
So I went back to school. I'm from upstate New York. I went to school in Roanoke, Virginia. That's where I met my now husband, and we live now in Magnolia, Delaware, which we came to Dover through the military, and we've been here for 20 years now. And actually, Bay Health was my very first nursing job. I was hired by Bay Health as a graduate nurse, and I went through school and got my bachelor's degree. And I work in many areas through Bay Health, but I've also found my niche, which is in the breast care department at Bay Health Women's Center.
That's awesome. That's a fantastic background. To hear you be able to pivot from music to now being able to care for others, that's absolutely fantastic. So I take it music is still a big part of your life?
Very much, very much, yes.
Well, what else do you like to get involved with besides music?
Yeah, so I'm a real outdoors person. So with my family, we have an RV. We love to go camping. We spend a lot of time with my daughters and her sports and other things. And now she's following my footsteps with children's theater and music, and she plays my instrument, which is the saxophone. So
Nice.
I only have one daughter, but she keeps me very busy. But it's always, every moment of each stage of their life is different, but it's all good.
So Trish, tell us a little bit more about your why and why you are in the field that you are in.
Definitely. Growing up, I had my best friend's mother who had breast cancer, and it was a very severe case. And I think as I got older and I saw other people experiencing it, our national average of 1 in 8 women will get breast cancer in a lifetime just really spoke to me. And I thought to myself, what can we do to help patients live longer and better? And early detection for all cancers is the key. So going into health promotion with, making sure patients know how to do their home breast exam, making sure that they know what their screening guidelines should be. That was something that really spoke to my heart. So now working at the Bay Health Women's Center as a nurse navigator, it is something that I get to do each and every day. And I'm so happy to be part of the solution for patients, even if they do end up with a cancer diagnosis, to be supportive for them and help make it so they just have to show up to their appointments. That's really my goal.
That's fantastic.
And you even have been touched personally, not just as watching a friend's childhood, but personally with breast cancer.
That's true. Yeah. So 5 years ago, I was on a routine mammogram. So, early detection at its finest. Just 42 years old. No significant family history in my immediate family, but it was just something that just popped up. It was an early stage, and I'm so grateful for that. Most of our cancers can be diagnosed early and really be treated and cured in my case. There's going to be unpleasant months that come after surgery and after treatment. But it's if you have supportive people around you, whether that be your doctors that you trust and love, or if it's the nurses that are helping guide you through the way, or just your friends and family who bring you some dinner. I think that, those are the things that got me through that experience. And again, it gives me more of a drive to help those that are coming after me so that I can share my experience with them and let them know it's going to be okay.
Yeah. You do a great job in your role, I know. Tell us a little bit more about what you do every day and what your day-to-day looks like as helping somebody who might be facing breast cancer or just coming in for a screening.
Sure. So most of the time, if a patient comes in for a screening, and the guidelines still are for the American College of Radiology, age 40 and over, if you're of average risk, that meaning you don't have a significant family history. So that would mean that every year, starting at age 40, I need to see you. Now, if someone has a family history, that just means that their doctor and they will talk about their different screening guidelines as they may need to come in sooner or younger. Patients that would see me at the Bay Health Women's Center would be someone who might be called back after their screening. Perhaps in my situation, something had changed. And the second situation would be as if a patient came in and they were experiencing some symptoms at home. Perhaps they found a lump. Perhaps they were having some pain or something unusual out of the ordinary.
So what is your greatest, what you do is so important for any patient. It's not just really being able to, as you mentioned, being able to help them through their appointment, but really to guide them through the journey and the process. Can you tell us something or tell us a little bit about what impact that has on you personally in that role and the impact that it has on those that you happen to serve?
Yes. We help a lot of patients in the community with our no-cost mammogram program. Back when I worked in oncology 20 years ago, we started those grants, and they have continued through our Go Pink campaign with the T-shirt fundraisers and things of that nature, but also some private grants. So I really love that we can help patients in the community know that there is no barrier as to why anyone in Delaware shouldn't be able to get a screening or a diagnostic if they have a concern. But so getting that word out about those programs is definitely one of our priorities. And then you have kind of having someone look at me and say, really? You're going to help me? I think with that resources, because a lot of our patients that are, working but maybe not afford insurance, can't afford, things on the marketplace. Those are the people that we're really trying to help through those programs. And then another situation would be if, someone comes to our program, just as a regular patient, they get called back. They are so anxious, rightfully so, to come in and have a nurse call them and say, hey, we need to see you again. And that's a very unnerving experience. So they get their additional testing. I meet with them. We go see their doctor. We find out what the plan is. And they say, I came here so upset and so wound up, but after talking to you, I really feel like I can do this. And again, that's just instilling some hope and some confidence into the women and men sometimes, that are really afraid when they walk in the door, feeling like they have confidence when they leave.
And I think one of the things that I would love to call out about our program is that if you do get called back and you have a second screening, maybe an ultrasound, you or somebody else sits with them and a radiologist to go through those results that day. So you're not just finding out what happened, through my chart or later on through a doctor. Can you talk about, why we do that?
Definitely. I think it's just the human experience. We need to be transparent with our patients. It's not always going to be good news. But if there's something that we can, go over right then and there, we can show them their pictures and give them a plan, so that they can be on track. And then they know that I'm going to help them to get those next steps coordinated. And, I'm going to help with the paperwork and things of that nature. I think it just gives them a little more support knowing that they have someone on their side.
Yeah. That's fantastic. So that's great to know that when someone comes into your clinic or your department, that you have the ability to be able to provide that support right after they receive that diagnosis. But can you tell us a little bit about how you help to prevent or give some prevention tips around how that can for individuals who are approaching that age?
Definitely. So cancer risk assessments are very important, and there are ones specifically for breast cancer. So at age 25, the new recommendation through the American College of Radiology is that every patient sit down with their doctor at age 25 and find out their family history and see if they are at any elevated risk for any of these types of things. So like I said, if you find out you're predisposed by genetics, or if you have some family history, then that's something that we can start screening you early for.
So you were really able to give us a great idea about what kind of support you provide for patients once they get their diagnosis. But can you tell us a little bit about how a patient or a woman over the age of 40 or the recommended age can really begin to think about what prevention tips are available to them as they're approaching that age?
Actually, that's a great question, because it is now, after the American College of Radiology recommended that all patients at the age of 25, female patients over 25, get a cancer risk assessment. That's something you can talk to your primary care doctor about. That's something you can talk to your gynecologist about, and to see what your risk factors may or may not be. If you find out that you're of average risk with no significant family history or any genetic predisposition to breast cancer, you will start at age 40 for your screening mammography. But there are a different subset of patients who will start much sooner than that. As far as other prevention tips, exercising, decent body weight, eating healthy, those are all cancer preventative type tips. Definitely, keep the alcohol on the low side, and also don't smoke.
I'm just curious. I know a lot of times we hear about healthy diets and what that can, it's kind of a vague term that many people use for various things. Is there a recommended diet or the amount of vegetables or fruit juices you should be drinking, or whatever those should be? If you can speak a little bit more about that.
Sure. So, of course, everyone will have a different thought about that. In my opinion, as far as healthy nutrition, it would be just low processed, more whole foods, whole grains, dairy, and also just low fat.
Makes total sense.
Mm-hmm.
So as we look at prevention, there's also detection, because finding it early can prevent even, things getting worse before you're diagnosed. So what would you, aside from obviously filling out this survey, the screening when you're 25, what are the other types of preventive tips?
Definitely. So all patients, after they start their menstrual cycle, should be doing their home breast exam. Patients can, just try to check themselves. If you have a regular cycle, you should be checking your breast once a month after that cycle is finished. That way you have the least, lumps and bumps. Okay, we don't need false positives, that's for sure. Yeah. Seeing your gynecologist, someone should be checking your breast as well, at least once a year. And then again, depending on your risk factors, but definitely by age 40, you should start the annual mammography.
We have come such a long way in the types of, detection. And what are some innovative new things that we offer at Bay Health?
I'm glad you asked that, because Bay Health actually is the leader, I feel, in breast innovation in Delaware. We were the first ones to implement artificial intelligence with our mammography program, and now we also use it for our breast ultrasound as well. So these AIs put your pictures into a database of thousands of others in an instant and give us a predictive value to say, does this area look like cancer based on this other database of people? Yes or no? And it really helps the radiologist and to say if this patient might need a biopsy or not, which, as you know, is very significant as far as what the patient's pathway could be. And the second thing that we're doing, we have always been concerned about our patients with dense breast tissue. And there's nothing wrong with someone if they have dense breast tissue. Actually, half of us do. Mm-hmm. But it's one of the things that the mammography can be a little limited with 3D and make it a little bit harder to find small masses because of just the way the mammogram appears in the background. So we recently had also the first in Delaware to implement ABUS, we call it, automated breast ultrasound, which is something that we would encourage patients with dense breasts to get with their routine mammogram. It's not instead of, though. So patients ask me that all the time because they think that mammogram might be uncomfortable once in a while. But it is, there are studies that go together. So we still would like patients to come in once per year for those exams. And then we can have the radiologist look at the mammogram and the automated breast ultrasound to see if there have been any changes from year to year.
I feel like one of the things I also hear a lot of people advocating for these days are asking for an MRI if they have a dense breast tissue, and knowing when you get the letter back after you have your mammo where it says, by the way, you do have dense breast tissue, maybe to advocate for yourself. Can you talk about when you should advocate for yourself?
Yeah, definitely. And I think our radiologists have really gotten in tune to adding that recommendation to your report as well, because our radiologists are breast specific. They're highly trained. They are well versed in their trade.
Yes.
They know what to do, but maybe the GYN or the PCP may not be as familiar as with the guidelines. So we've really been encouraging them to include these new recommendations in the report. So when the patient gets to sitting down to go over their results with their physician, they can say, oh, by the way, I really like an order for this ABUS because I have dense breast tissue and I know this is going to help find small cancer sooner. So again, kind of giving the power is not, or knowledge is power type of method, that would be something that we would encourage the patients to do. And, being part of the My Chart, that they can read over the exact recommendations at home and really have a good understanding of what their guidelines are.
So if someone is doing their breast exam at home and they don't have the ability to get it from an MRI or any type of exam within the clinical setting, is there a way that they can tell if they have dense breasts or not?
Not really.
Okay.
So that's a good question. We have patients coming in saying, I know I have dense breasts, or I know I have fibrocystic breasts. So those are radiologic findings. So the mammogram will tell us if it's dense or not, meaning it has a whiter background than, say, someone who has fattier breasts, which is a grayer background. And then we also have patients who might think they have cysts. So the only way we can find out if it's a cyst versus a solid mass is with an ultrasound. So you might have, a breast lump, or even some physicians may have told them they have fibrocystic breasts, but that may or may not be true. It really is a radiological finding.
That's great to know, because I'm sure people are out there thinking that they do and they don't. So make sure that you come and have someone test you.
Change over your lifetime. So 20s, 30s, 40s, it's very common to have dense breast tissue because those are the glands that could make milk. So most of the time after menopause, that tissue will kind of decrease, but it's not at the same age for every woman, and it's certainly not with the snap of a finger, and it's not even symmetric between right and left. So it is very good to know what your breast density is, and again, but you only have to actually get the imaging to find out for sure.
Right.
I was going to say, this is probably a good time to mention we are doing some free breast cancer clinics and screenings. So if you do want to go and get a mammogram and find out what the density is of your breast tissue, there's one coming up at Verona Woods, October 18th, and then October 24th at Milford Senior Center. We also had one at the Dover Public Library. So these are opportunities for anyone that can come out and get some sort of an exam, at least a pathway forward for getting care.
Definitely. I would encourage everyone to take advantage of those. We do require that patients have an order for their mammography.
Yes.
But honestly, you could call the Bay Health Women's Center and often just show up and we can work you in. Happen to be the day off, you're Bay Health Dover, we can definitely, have you get your mammogram with no wait, often pretty much any day of the week.
That's great to hear. Sometimes it's hard to be able to get an appointment to get different checkups. So it's nice to know that you can just have an order and then call right into the office and you'll be able to get one.
Yeah.
So we've talked a lot today about preventative care, about being able to have detection early and all those pieces, and those are all great to be able to do up front. Can you talk to us a little bit about what happens when a patient is actually diagnosed with breast cancer? What kind of support and services do you happen to provide?
So, we do have to give bad news sometimes. We see patients through the screening process, through the diagnostic process, and through the biopsy process. Our goal really is to have those steps done within the least amount of time possible, because I think once we at least finally get a diagnosis and we can get a plan together for each patient, it kind of gives a little bit more of a direction versus just kind of waiting, But we sometimes patients will have a very complex road ahead. Depending on what their diagnosis is and, what they're facing, they may have to have surgery first. They may have to have chemotherapy first. They may have to, go through multiple tests, such as a breast MRI, through staging scans for CT and things of that nature. So, all of us, especially here at Bay Health, we do have nurse navigators like myself on the radiology side, but we certainly have them at the oncology side as well. And so their job is to do what I do, and that's to have the patient just be able to show up for the appointments. So we help with referrals and authorizations. We help with educating the patient so they know what to expect when they go for the tests. And then, we give them an idea about how long the results could potentially take and whatnot too. So it really helps give them, more of a timeline, when they might hear something back.
And knowledge is definitely power. So if you understand kind of what's happening and the steps to be able to help combat that, that's very helpful.
Mm-hmm.
How would you suggest, if you did find that one of your loved ones or a friend, family member was diagnosed with breast cancer, what would you suggest you could do to help as just, a friend?
Yeah, so I think that's an excellent question, because I think sometimes patients are like, oh, this is a private time. They need their space. I needed somebody to take my child to school for me. I needed somebody to pray for me. Mm-hmm. I needed somebody to, again, I had my friend come over and she would clean the bathroom for me. Different things. And it's just the little things, and you would think, oh, I can't make a difference to my friend or my family member. But, if even if it's just prayer, even if it's just a card with some encouraging words, even if it's just take my daughter out because I can't, type thing, or mow the lawn for me or something like that. I think there's always something that we can do for, our loved ones or our friends or family that could really make a difference.
Yeah, that's really important. Mm-hmm. That sense of community and really being able to be supported in that way, it always makes a huge difference. Absolutely. Yeah. So we're about to wrap up right now, and so I'm just curious, is there anything that you would want our audience to know that we didn't happen to cover with you today?
Definitely. So, I am a healthcare provider. I am a daughter, I'm a mom, and I am a nurse. And I know how busy we get. And I just want to make sure that our healthcare providers, moms, wives, whoever we are, know to get their routine healthcare done. And that means your annual physical with your physician. That means your cancer screenings. And because I have patients every day coming in that are colleagues of mine, and they say, I think I was here last year. And we look them up, and it was 4 years ago. Mm-hmm. And, a lot can happen in 4 years. There's so many cancers, unfortunately, that we cannot screen for. But, with the breast cancer, obviously, there's a mammogram. Cervical cancer, we have pap smears. Lung cancer, we have a CT scan. So there's different things that we can do to help. And, I think that sometimes we get so busy caring for others that we forget to take care of our own preventative care, and I think that's the number one thing that we should be doing for ourselves.
Absolutely.
Such important advice.
Such important advice. So we talked a lot today about prevention tips and detection tips for women. I'm just curious, can you talk to us a little bit about men who have been diagnosed or are interested in being able to examine themselves for breast cancer?
Definitely. So we see, I would say, one male a day in my clinic, and most of the time it's not for breast cancer related reasons. Maybe they're having pain or they feel something, but not often do they have to go on for biopsy. But we do have a significant amount of gentlemen coming in because they have strong family histories. Maybe their mom and their sister, maybe there's what's called a BRCA mutation in their family that might predispose them to getting breast cancer. So for those patients, we do highly recommend, making sure that their doctor is checking their chest and their underarms on a monthly basis, and also that they would be able to check themselves at home. If you feel something that doesn't move left or right, feels like a pebble or a marble, those are things that we would need to see a patient for right away. And men don't think that we can, but we can certainly do a mammogram for a male, and breast ultrasound is also very helpful. So if we can see something there that would require a biopsy, we can definitely offer them the same services that we do for a female patient.
Great to know.
Mm-hmm.
One of the other things that I feel like we do so much of is support the community and work with other organizations to help support the community. Can you talk about some of the partnerships that you have, working partnerships in the area?
Definitely. So we have a long-standing and great relationship with the Delaware Breast Cancer Coalition. We support their programs, they support ours. It's just really a great, camaraderie that we've grown over the years. One of the best things that we have going with the Delaware Breast Cancer Coalition is their patient outreach coordinators that speak Spanish and French Creole. They're going out into the communities, and they look like the patients, and they're making them feel comfortable to come in, and they even offer them transportation. So it's fantastic, the support that they give us, and they help our practitioners when we're doing our preclinical breast exams, and they're offering all sorts of resources, again, for the transportation and also the interpreting services at no charge to the patient.
So important. We could not do it alone. We
I
need
agree.
every little bit of help and all the resources available to get the job done.
Definitely.
Well, Trish, thank you so much for joining us today and really giving us this incredible information around breast cancer awareness, as well as prevention tips and all the pieces that come along with that. Very valuable information. We can't thank you enough.
Thank you for inviting me anytime.
Thank you. And thank you for joining us for this episode of Scrub In. Don't forget to tune in next time.
Thanks for listening to Scrub In, where we bring purpose and care to every conversation.
If you enjoyed today's podcast, don't forget to subscribe, rate, and review on Apple Podcasts, Spotify, and wherever you listen.
Stay connected, stay informed, and stay inspired right here with Scrub In.